Hi, it's Dr. Ken from Spinal and Sports Care Clinic, Spokane Valley, just between McDonald and Pines. We've been here for quite a few years, and one of the things that we really like to treat, and we treat a lot of, are headaches. This is a huge topic. I've got Ed here to help me out a little bit, but we're not going to get to all of the stuff. So I'm just going to kind of give a 40,000-foot overview of headaches, and we'll kind of go from there. As of right now, if you look at the International Headache Classification Manual, sounds very fun to read. It is kind of boring, but interesting depending on how you look at it. There are well over 100 different headache types. I think there's 250. I can't remember. But for us, we're going to kind of classify things in a couple simple categories. So first, we're going to say there's the uh-oh headaches. I'm going to put Ed down over here. There's the uh-oh headaches, as in, uh-oh, go to the emergency room, okay? And there's everything else. So I don't treat uh-oh headaches. I send you to the ER. Those headaches are pretty rare. So that would be things like I'm having a stroke, or my artery has a tear in it, or I've got an inflamed artery in my temple. Those are the sorts of things. We evaluate and make sure you're not having those. And if you do, we send you off to the ER. Again, very rare. But most headaches are going to be migraines, they're going to be a tension type headache, or they're going to be cervicogenic, okay? So, and within that, I kind of separate migraines out and then the other two. True migraines are difficult to treat. And when I say true migraines because headaches overlap a lot. They are not separate, nice, tidy packages. They overlap. And so people with tension type headaches can actually have similar symptoms to migraines, and cervicogenic headaches, which are headaches coming from the neck, the upper cervical joints, are really good at mimicking migraines, but they aren't. People who generally get lots better from migraines with a cervical adjustment, that's typically maybe more of a cervicogenic headache than a true migraine. For chiropractors, what we do for migraines is we manage triggers. So we look at dietary triggers, chocolate, red wine, histamine-rich foods. We look at the jaw. That's why Ed's here. We'll look at these muscles here in the jaw. They can trigger headaches. The ones down deep here can trigger headaches. We look at the cervical spine and make sure that the neck isn't triggering headaches. And we look at it more of a management point of view rather than a curative point of view. I may not be able to cure your migraines, but if you have a lot less per month, you're going to be better off. That's exactly what we're looking for. The other two type of headaches, cervicogenic and tension type, we are more likely to be able to really move the needle on those. We can move the needle on migraines, like I said, but getting rid of them completely is hard. But a cervicogenic headache, that's just a headache that's coming out of the cervical spine, right? So the joints are stuck and irritated and they're causing head pain. Well, what's the solution to that? Adjusting, releasing the soft tissues, all the muscles, doing muscle release, and then stretches and exercises to prevent the joints from getting stuck anymore in the first place. That combination, it works really well. And it's the same, pretty similar for tension type headaches. Tension type headaches, right? Abnormal muscle tension, triggering headaches. First thing we have to ask is, why is the muscle tension there? Is it bad posture? Is it your job? Is it your eyes? Do we have to give you special stretches? Or is it stress? Maybe you're just a stress ball, and every time you go to work, you get a headache. That might be a different problem. That might be a new job problem, but that's not really our area. So depending on what type of headache it is, there are tools that we have to help. And so that's the most important thing when it comes to headaches for us is classifying them. What are they? What do they respond to? And then we can figure out, okay, what's the best approach? If it's a migraine, like I said, manage. If it's these other two, we have an eye for, let's try to fix this problem as much as we can. So a couple simple tips to help you with headaches regardless of type, besides the uh-oh headaches, is hydration. So there's a recent study that showed that in migraine patients, confirmed migraine patients, just drinking more water could reduce headache frequency by 25%. That's a lot. So if you have 10 headaches a month, you could go down from 10 headaches to 8 headaches. And as any migraine sufferer knows, 2 less headaches a month is a lot. Okay, so just drinking a lot more water. I would say you want to drink at least probably 80 to 100 ounces a day. I do encourage some of my patients to hydrate using something like body armor or a sports drink if they have a job where they get dehydrated quickly. A couple other things that you can do. One of my favorites to do is to grab a tennis ball or two. You can get these at your local tennis club, Walmart, whatever. I usually take 2 of them, I put them in a sock, and I put them right underneath my skull here, and you can just lay on them and do some self-release to those muscles. Massage is also another helpful tool, but the massage therapist does have to know what muscles to work on. It can't be just a global massage. It has to be specific. There's certain muscles that cause headaches. We really want to target those. We'll talk about that in another video. I hope that helps.